Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. In this segment, we're going to have a brief conversation with Olga. Now, Olga's a special education teacher from California who's living with a rare inherited rapidly progressive disease called hereditary ATTR amyloidosis, also known as hATTR amyloidosis. Olga is here to discuss the impact that this disease has had on her family's life as well as her own life. She's going to talk a bit about her experience living with it, including her participation in a clinical trial for AMVUTTRA. It's a new treatment recently approved by the FDA to treat this condition in adults. Welcome to Health Professional Radio, Olga. Thank you for joining us.
Thank you for having me. And I am a paid consultant for Alnylam Pharmaceuticals. So I appreciate you having me. And I'm super excited to be able to speak with you today and share my personal experience.
First, tell us how you first learned about hATTR amyloidosis and how you came to be diagnosed in the first place.
Well, my journey with hATTR amyloidosis began long before I even began to experience my own symptoms. I witnessed, sadly, my mom battles very strange and debilitating symptoms. And some of those were neuropathy, which she had, burning sensation in her hands and feet, that over time actually progressed up to her arms and legs. And it was a long time for her to get diagnosed, but she eventually was diagnosed with hATTR amyloidosis at 60 years of age when we went to Portugal looking to get her tested there. And then at that time, she did not really have a treatment plan where her doctors really were only managing her pain. There were no treatment options available. So my mom's symptoms actually got worse over time. And over a course of about 8 years, she was bedridden and eventually passed away when she was only 68. And then the other person in my family would be, I have a twin brother named Marco. He began to experience similar symptoms when he was 43, and he was diagnosed, actually before he turned 43, and was diagnosed when he was 43. It was really devastating for me to see that because I had seen what my mom went through, and my brother's disease at that point, again, there was no treatment, began to progress through the years, just like my mom, and, his hands, his feet, sometimes he would burn his fingers and his hands when he was handling food dishes that were hot and not realize that he had even burned them. I became very scared of getting tested because I knew it was hereditary. And even though I didn't have the symptoms, severe symptoms like my brother, I did have carpal tunnel syndrome at some point and also experienced plantar fasciitis back then. And I was terrified that maybe those could be attributed to the hATTR amyloidosis. And eventually I decided to get tested. Marco was encouraging me to do so. And sure enough, the results came back positive. At that point, it was just really difficult news to take in. I was in my classroom and I felt like the ceiling was just going to cave in on me. I was overwhelmed. Just with the thought of of that diagnosis, terrified because I had seen what it did to my mom, and I was seeing how that disease was progressively just impacting my twin brother in such a severe way. And so at that point, I was just...
Were you a caregiver for your mother and your brother?
I was not a primary caregiver, although we hired some people to stay with her. She needed 24/7 care. But I was there practically every day after work in the evenings. For Marco, he lived a little bit further away. He had his own caregiver that he hired, and obviously I would, visit him on a regular basis. But I wouldn't, I did what I could.
You talked about having no treatments when your mom was diagnosed and the same condition when your brother was diagnosed. When you received your diagnosis, what type of options were available for you at that time?
Well, by the time that I received my diagnosis, I had already, my brother had been doing a lot of research and was aware of some clinical trials. And so at that point, I was very eager to find something that would potentially help me. I had first learned about the HELIOS-A Phase 3 clinical trial from Marco. And at that point, he had told me that I probably would have to get evaluated to see if I even qualified. And this was a study that was evaluating the efficacy and safety of vutrisiran, the AMVUTTRA, and in patients that are like me with the hATTR Amyloidosis and with polyneuropathy. That drug actually went on to be approved by the U.S. FDA as AMVUTTRA just a couple of months ago in June of this year.
So you weren't hesitant about joining this trial once you heard about it and realized that there was a possibility for some care? Well,
there was a bit of a time lapse because even though I received that diagnosis, it took a while for me to really accept that diagnosis, which was around August of 2018, and I really didn't get started with the clinical trial until the following year, like July over the summer of 2019. So there was a huge learning curve there in accepting that diagnosis.
Okay. Well, how has AMVUTTRA worked for you thus far?
Well, since enrolling in the HELIOS-A study and starting that treatment with AMVUTTRA, my neuropathy impairment has improved. I still enjoy being very active, and I'm a jogger, a runner. I like to take walks with my husband, so I'm very grateful that I'm still very mobile. I'm not really experiencing the severe symptoms that I thought I might have, but I believe that AMVUTTRA is really helping me with that. I have a very busy schedule, and so for me, the biggest bonus or the biggest plus about the treatment is that my dosing schedule is once every 3 months, and as a teacher, that is huge because I'm missing very minimal school time. Of course, there are times when I have my treatment, when I receive the AMVUTTRA dosing, that I feel fatigued, a little bit fatigued. My vitamin levels have decreased. And those are some of the common side effects that AMVUTTRA has seen during the clinical trial. There are other symptoms that you can have. I have not experienced these, but one of them is arthralgia, which is joint pain, dyspnea, which is shortness of breath, and of course, I've mentioned the low vitamin A levels. Everyone may have a different experience, but that's been my experience thus far.
This is a rare inherited disease, although it happened to your mother, yourself, and your brother. Have you found it difficult to get any other information on this condition now that you've been diagnosed? Is it still quite a challenge to get properly diagnosed?
I've done a lot of research, and Marco has as well, and I believe, I think I heard that the average time, someone was telling me that they had read something that it takes a while because of the symptoms. It could be something else. It takes, can take a while for a physician to diagnose this disease. I noticed that there's more information since I've been in the clinical trial, and maybe that's because I've actively been looking for it. So initially, though, before there was nothing. No one really even knew what amyloidosis meant. So I believe that that's my goal. Is I hope that it becomes more and more popular. That's going to be out there so people can hear about it.
Well, Olga, is there anything that you'd like to add for our listeners?
Absolutely, there is. I would say that if you are out there, you have carpal tunnel, you've got plantar fasciitis, something like I did, and you're trying to get a diagnosis, or your doctors are saying it might be something and it sounds odd, I just encourage you to advocate for yourself and to ask a lot of questions, to do research, and just do that, because the key to this disease is early detection, early diagnosis, and early treatment. And by doing that, you're going to maximize, what your outlook is going to be like. And I just want to encourage anyone that's out there that is looking for answers, or they're a diagnosis that doesn't make sense, or they're getting a different answer, to just pursue that with just as much, determination as possible, because it can be a disease this misdiagnosed. And even with my mom, they didn't think that she had anything to do with her nerves. They thought it was, something else. So I encourage people to do that.
Well, tell us where we can learn more about AMVUTTRA.
Well, you can get more information at AMVUTTRA.com. That's AMV as in Victor, UTTRA.com.
Olga, I appreciate you joining us here on Health Professional Radio this evening, and maybe you'll come back in the future and give us an update.
I would love to do that.
Great.
Thanks for having me.
Okay. You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Olga. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com Health Professional Radio.